At this time, Carrie, Rebecca, Tracy, Trinity, and Claire will share the class reflections.
As we stand here tonight and look back upon our journey, we think back to our first semester. One of the first things that we learned was the nursing process. We were taught to assess, diagnose, plan, implement, and evaluate. It seemed foreign and complicated, but it has become second nature to us now. We're going to use this process to reflect on our 2 years here at JCC. As we started this journey, we had to assess ourselves. We assessed our minds first. Did we have the clarity to envision our plan? Did we have the extra space to absorb 500 plus pages of material of reading each week? How would we keep our sanity with all of the responsibilities that we have? We assessed our hearts. Did we have the heart to care completely for our patients? Do we have the courage to venture into a new career at this point in our lives? Did we have the passion to allow this profession to become part of our essence? Did we have the commitment required of us to sacrifice so much time that could have been spent with our family and friends? Next, we assessed our stomachs. Were they strong enough to deal with all the sights and smells that go along with nursing? Did we have the gut instinct that is required of a nurse? Next, we looked at our endurance. Were we able to stay up all night long to prepare for clinical the next morning? What was it going to be like going to school every other weekend for 2 years with only one break in the middle? What happens if class is canceled due to bad weather? How will we make it up? The day we lost power in the middle of class, no one wanted to leave. We sat close to the windows to take advantage of the sunlight so we could continue. In fact, class cancellation was a concern just before our last weekend of school. The general consensus was that we would be there even if no one else was. Many of us are not traditional students. We have families and jobs and have accomplished this while maintaining our other roles. Sometimes it meant doing our homework while our children did theirs, or while cooking dinner. Multitasking is no longer foreign to us. It has become a way of life, such as bringing your books to your child's sporting event or doing your clinical homework while on family vacation. We had nursing student syndrome. Every disease we covered, someone in class thought they had it. We had to assess our skin and circulatory systems because sitting in JCC chairs for 8 hours at a time increased our chances of pressure ulcers and clot formation. Flexibility is another characteristic that is valuable in a nursing student, especially when you are the first weekend class. You must be able to go with the flow. Last-minute room changes were part of our experience. Much to Julie Roy's dismay, the mid-class room change during an 8-hour farm lecture stands out the most.
Now that we have evaluated the nursing student, we must diagnose them. Appropriate diagnoses include, but are not limited to, anxiety related to testing and critical elements as evidenced by student shaking and crying.
Ineffective coping related to extreme stress, as evidenced by eating chocolate during class and the urge to drink copious amounts of alcohol after an exam.
Fatigue related to clinical preparation, as evidenced by large amounts of coffee in pre-conference.
Anticipatory grieving related to waiting for exam results, as evidenced by crying.
Risks for impaired skin integrity related to student positioning in class and hard chairs.
Risk for ineffective tissue perfusion related to sitting in one spot for 8 hours at a time.
Imbalanced nutrition, more than body requirements, related to stress eating, as evidenced by large amounts of sweets and snacks in class and weight gain.
Self-care deficit related to early morning class, as evidenced by students wearing their pajamas to class.
Disturbed thought processes related to lack of sleep and information overload, as evidenced by singing Wonder Pet theme song and uncontrolled laughter.
Impaired social interaction and communication related to lack of socialization with people outside the nursing program for the past 2 years, as evidenced by the inability to think or talk about anything non-nursing related.
Altered urinary patterns related to lack of time to go to the restroom during clinical, as evidenced by seriously considering self-Foley catheterization to get through the day.
Disturbed visual perception related to lack of sleep and excessive amounts of caffeine, as evidenced by blurred computer screens while typing endless amounts of clinical paperwork.
Now we have planning and implementation. The interventions to deal with these diagnoses is the next phase of the process. Appropriate nursing interventions for the above diagnoses are as follows. Allow the student to speak freely about their frustrations. Listening to them is very important. Discuss appropriate coping measures such as screaming, crying, eating, and drinking. Talk to the student about ways that they can relieve their stress without causing harm to self or others. Allow students time to rest for at least 8 hours per night. Provide student with large amounts of caffeine, sweets, and carrot juice for that quick pick-me-up. Prompt posting of exam grades will alleviate large amounts of stress for the nursing student. Have student log into smartphone and go to JCC website where exam grades will be posted and continue to hit refresh for the next 5 hours until grades are posted. Have students stand and walk around the classroom frequently during lecture to prevent formation of pressure ulcers and blood clots. Student may also bring protective cushion to promote circulation. Have student break up the reading over a period of 2 weeks instead of waiting until the day before class to read 500 pages. Allow student to pair up with another student to vent all frustrations and share a tissue or two. Allow student adequate time where they are not allowed to think or talk about nursing or school. Socialize the student with other people at least once a month. Administer saline eye drops to both eyes when student's vision becomes blurred. If that does not work, just agree that you see it.
The evaluation phase. During the last 2 years, we have been through a lot. We have grown as people, and we have become nurses. Nursing is not just another degree, it becomes a way of life. It becomes a part of you. The journey is not an easy one. In order to succeed on this journey, your studies must become a priority in your life. And life does not stop for this. On this journey, we have gotten married, we have had babies, we have lost parents, grandparents, and we have lost children. Our spouses have gone off to war. We have missed out on many things in our families' lives. Some of us have stumbled on this journey and had to pick ourselves up and carry on. No matter what life has thrown at us, we have held on through it all, even when it seemed impossible. This program is highly competitive. From the beginning, the pressure is felt. A mission is a privilege, and the coursework is rigorous. Our instructors expect the best from us, and we strive to be the best that we can. We started out as novice nursing students, and with the guidance of the faculty, we have become expert nursing students. As we enter our practices, we will become novices once again. The learning process for us is lifelong, as we strive to give our patients the best care possible. This experience has changed us all, and we will always be connected to one another. As a nursing student, you go through things that only are understood by others who have gone through the same experiences. We have been there for each other the last 2 years. We have laughed together, cried together, and everything in between. As we venture out into our careers, we will never forget our time here at GCC, and we are grateful to our instructors and our classmates for all the guidance and support that has been shown to us. And also, we would like to take this time to send a special thank you for Trinity for her hard work in putting together the slideshow that you are about to see and help making this a very memorable experience. Thank you very much, Trinity.